So, Dr. Mpoki, why did you choose averting maternal mortality as the theme for this year's SATA conference?
Well, thank you very much for your question. The reason behind the choice is because we still are grappling with a very, very high number of women that die of childbirth-related complications. At the moment, the maternal mortality in Tanzania stands at 556 per 100,000. Now, that's a very, very big number when you compare to countries such as Finland, where 2 to 4 women die in a year because of pregnancy-related complications. That was the reason, because we want to contribute to averting the deaths that are caused by childbirth-related complications.
So Life Support Foundation has played an active role in SATA since the start. What does the collaboration mean to you and to the anesthesia in Tanzania?
Well, this collaboration is so close to my heart because Tim and I started working a long time ago, 2007, when we established the Muhimbili Karolinska Institute collaboration. And out of that, when Life Support Foundation came aboard, the support that we've received from the foundation has been immense. And generally, the professionals of Sweden and the people of Sweden in particular. The reason this is very crucial is the support that students have received, those who are doing postgraduate studies, but professionals in practice who have been afforded an opportunity to travel to Sweden to see the first world and how anesthesia is practiced in the first world, which helps people to think beyond their comfort zone at the normal levels. And so it's so crucial. The books that we've received, the flash discs that have so much information that will help our people in the leisure of their offices and homes to learn without any impediment. That is what makes Life Support Foundation really a Life Support Foundation to the Society of Anesthesiologists of Tanzania.
So what are your goals for the coming years in averting maternal mortality, and what are the most important steps to take in order to reach this?
Well, number one, the goals are to empower all anesthetic service providers with ample knowledge to provide safe anesthesia with. We do not want any person that has not received any training to offer services, because when complications come, they will not know what to do. As a nation, we are embarking at rolling the comprehensive obstetric and emergency obstetric care in our country at the level of a health center, and then we go to the district hospitals, then we go to the regional referral hospitals. So all these levels, we expect to ensure that trained manpower is deployed and equipment that are relevant for the provision of safe anesthetic services, together with the drugs to accompany the provision of these services as a prerequisite. The steps will be to make sure that a curriculum is in place for the training of nurse anesthetists, and this will provide them with a professional career path, because they'll do the undergraduate degree, they'll be free to pursue a master's degree and even a PhD if they so wish, because this is going to be formalized. Then we shall have a scheme of service specifically addressing the presence of this particular specialization in our healthcare scheme of service. The kind of personnel that will be found to offer services. So steps will depend on the availability of resources. We are mobilizing resources to have training for nurse anesthetists, but also we are trying to negotiate into finding a revolving fund for the training of postgraduate anesthesiologists in place. And this is going to be sustained for the longest of time possible.